On the occasion of International Childhood Cancer Awareness Month, Shankara Cancer Hospital and Research Center has organized a patient awareness program. So today we are going to discuss about the support which Shankara Cancer Hospital and Research Center is providing to the patients and families who are affected with childhood cancer. Today we have Srimati Rama Ramamurthy, in charge of the charity section as well as medico-social department with us. Welcome ma'am to the program today. So today we are going to discuss some of the aspects of psychosocial support which is required for treating childhood cancers. We already know childhood cancer, although fortunately it's rare, but we do see cancers in children. Childhood cancers are treated usually with chemotherapy, surgery and radiotherapy. So it may take a long time, sometimes up to 1 to 2 years for completing the childhood cancer treatment. So a lot of things are required. There is a saying that it takes a village to treat a child with cancer. So let's dissect and discuss one topic about managing childhood cancers. So for example, a child with leukemia, the treatment would go on anywhere between 3 months to 3 years. So madam, how are you going to address the issue of the expensive treatment which is the child has to undergo? As we all know, the chemotherapy is expensive, the surgery, radiation all requires a lot of supportive care, a lot of financial support. So a child comes with some leukemia or a bone tumor, it requires a lot of financial support. So how do you help the kids who are suffering from these kind of childhood malignancies?
Sir, when you refer a patient to us, we find out from where they have come, what is the social background, what is their financial constraints. We address all of them and we found out what is the cost of the treatment and how long the treatment is going to run. So on these lines, we find out what is that the patient can afford. So what is that they cannot afford is gapped, and then support from our Sri Shankara Cancer Foundation is also given. And we do have a lot of NGOs who help us with funds for the treatment of these children. Especially we have Indian Cancer Society, Mumbai, Indian Cancer Society, Bangalore, who is helping us a lot in these treatment of these children. Also we have UV Can Foundation, which gives us a part of the money which we help these patients. And then we also have Accommodation Foundation, and we have Can Kids and Leukemia Crusaders, who bridge the diagnostic services and other supportive care for these children. This is how we can actually help them out. Putting everything together, we would finish the treatment for these children.
So it's very good to know that hospital is also providing a lot of discount towards the treatment, as well as hospital is taking support of the NGOs to complete the treatment. So madam, if I know, so many of these families, they come out of the city. Some of them they are maybe coming from North Karnataka, some of them may be from Andhra Pradesh or West Bengal or any other part of the country. So how are you going to arrange them about the stay? So how are they being placed? Because the treatment will go on for years together. They may not be in the hospital for throughout the stay. So how are you going to arrange it?
These children who come from outstation will need to stay in the hospital for more than 8 to 10 months. So they need not be admitted in the hospital for the whole of their treatment, but they need to come. Say they do not have any facility or any accommodation here in Bangalore. So we have one of our donors, Srimati Meera Naidu, is given us a hotel in Gandhinagar, which is 3 kilometers away from the hospital. So we do have transport facility where we can put these children there. It's a long stay facility with 30 rooms. So each family can take up a room, and we have kitchenettes for them. So they cook their food there and they take care of the child while under treatment in the hospital. So they do not have any hitch staying here in the hospital. So they stay in the hospital while they are going treatment is taken care of.
So it's good that hospital is providing support in terms of the food, the travel and stay in a location which is considered home away from home for these children who are undergoing treatment for cancer. So madam, so during the treatment, of course, nutrition plays an important role. We all know that more than half of the children in India, they are malnourished, they are underweight, and sometimes during the treatment, because of the side effects of the chemotherapy and radiotherapy, sometimes they will have nausea, they will not be able to eat food, they will have oral ulcers, their appetite will be low. So many of these kids will lose weight during the treatment, and if the child lose weight, their tolerance to the chemotherapy will go down, so they may not be able to finish the treatment in time. So nutrition plays an important role during the treatment. So how are you going to address in providing the nutrition for these families?
So the nutrition is also being taken care in the hospital. We have an in-house diet kitchen which supplies nutrition to these children, and we also have another organization called Cuddles. Okay, they have their 2 dietitians placed in the hospital who goes to each and every patient. They give a tailored diet to them, and they also provide ration baskets to the family. Even when they are in the long stay facility, they can cook, they have ration, they have vegetables, they have fruits, they have milk, they have curds, everything is being given to them. So that is also been taken care, and also they get high protein diet from the Cuddles organization, which is placed in the hospital.
So it's a point important to be noted is that Sri Shankara Cancer Hospital and Research Center is providing free food for all the patients who are admitted in the general wards, either it's a child or an adult, by a scheme called Annadasoha scheme. So apart from it, various other NGOs like Cuddles are also taken responsibility in providing nutritional support when the patient is admitted in the hospital, as well as when they are in the long stay center. So madam, some of these children, their usual phenomena is to go to school at that age. So these school going children, because of the treatment, they have to stay in Bangalore. So many of these kids are missing their schooling. So they will miss out on the classes, and also they will miss out on the touch of the subject as well. So how are we at the Shankara Hospital, how are we addressing the overall development of the child in terms of schooling is concerned?
This has also been taken care in the hospital, sir. We have an organization called Samiksha Foundation who come here twice a week, 2 days a week, and 2 days in our Lakshmi center also. They bridge the gap between the school and the treatment. So when the child is on the treatment, so his curriculum is taken care, his academics are being taken care by the Samiksha Foundation. The children are very happy attending these classes, and other activities are also being taken care. They have painting classes, they have yoga classes, everything is being taken care by this foundation.
The hospital is providing a social support group for the families affected with children with cancer. Along with it, there is a monthly birthday celebration for all children undergoing treatment, where there will be a magic show, some puppet show activities, some fun games for both children as well as the parents. So the entire family is being entertained at least once in a month, so that they will forget their pain and sorrows for at least for some time during the treatment. So treatment of child with cancer will usually require chemotherapy, surgery and radiation. So that when the child is undergoing treatment, many a times we may have to do various blood tests repeatedly, and also administration of chemotherapy. Sometimes when the child develops fever, the child will require to receive antibiotics and other supportive care medications. So it is very difficult for a child to repeatedly undergo pricks for finding an IV cannula. So at Sri Shankara Cancer Hospital, what we do is we put a device called chemoport. It's a vascular device which is used to do the blood sampling for all children undergoing treatment, as well as administration of all supportive care medications in the form of antibiotics, antifungals, hydration, IV fluids, and as well as total parental nutrition and other things. So all these things are taken care by using a device called chemoport. Madam, I would want to know that we all know that these devices are very expensive. How are you going to arrange the finances for these devices?
We have another NGO called Sukruti Charitable Trust who will provide us with the chemoports. Okay, and the insertion of the chemoport is taken care by the hospital. The chemoport as such is been given to us by Sukruti Charitable Trust. We're very happy about it.
The chemoport, the device, as well as the insertion charges, the OT charges, everything is managed by the hospital. And for many of these families, we are giving it free of charge, so that they need not pay for the machine, but they can go ahead with the treatment with the available resources. So, dear viewers, team at Sri Shankara Cancer Hospital is equipped with all the necessary things required to treat a child with cancer. And families need not be worried. We are very sure that the expenses and the cost involved in treating a child with cancer is humongous. Many a times the family may not afford the treatment. So the chemotherapy, the surgery, radiotherapy is usually expensive, but at Sri Shankara Cancer Hospital, through its contribution and discounts towards the treatment, it is providing various medicines at a discounted price. The radiotherapy and other surgeries are done at a considerable price, and many families are being supported towards the treatment. So we are very proud to say that more than 2/3 of the families at Sri Shankara Cancer Hospital who are receiving treatment for child with cancer are being supported either partly or fully funded by Sri Shankara Cancer Hospital. So the family need not worry about the finances. If they are short of finances, hospital is ready to support them in all possible ways, either towards in terms of the support for the treatment, in terms of stay at Bangalore, their schooling, their travel, their food and all other things which is required for treating a child with cancer. Thank you.